Hi, I am Mohamed Fakhreldin Attia, Chief Programs Officer at SmileTrain, based in New York. Unlike other charity organizations that are existing nowadays treating cleft lip and palate children around the world, SmileTrain can differentiate itself by its own model. We use the model of teach a man how to fish. So we do not fly over doctors from the US to other countries around the world. Instead of this, we depend completely on local doctors in their own countries, and we try to build up competencies from inside within. So, for example, in India, we depend completely on Indian surgeons, anesthetists, and nurses. By doing this and by training them continuously, we created very good base of local competent doctors who are able to offer the surgeries in very high quality and safety measures. So this differentiates us from any other charity around the world. The treatment of cleft and the surgery costs in the developed world could be catastrophic for parents and families who will not be able to afford the treatment of their kids. SmileTrain strives every year to offer comprehensive cleft care for those kids. SmileTrain is not only interested in doing the surgeries only, but also SmileTrain is quite interested in the area of training for the surgeons, anesthetists, and also nurses and other medical staff. By doing this, we create local capabilities and competencies in more than 70 countries around the world. There are few barriers and challenges to offer cleft care to children born with cleft lip and palate in the developed world. One also of the challenges that we are facing that those children in the developed world can be born unhealthy with other concomitant diseases, underweight, malnutrition, the lack of training in some countries, the lack of surgeons in some countries who are well trained to do these surgeries. All are these barriers we are facing in some of the developed countries. And SmileTrain is trying year after year to overcome these challenges. So, throughout our programs and program grants that we are offering to our partners, like Smile Grants, which is used to transport patients from their rural areas to the main cities. Also, we have got another grant like training grant, which can be used to train doctors, anesthetists, and nurses to offer quality services when it comes to cleft lip and palate. We've been working in India since 2000, and SmileTrain achieved marvelous outcome from our programs in India. Right now, we are speaking about almost 500,000 surgeries since inception in India. We have got more than 160 partners in the country, and we have got more than 250 qualified surgeons in the country. So SmileTrain is year after year adding more partners in India, treating more kids in India. The prevalence rate of clefts in India is about 35,000 child born each and every year, while SmileTrain is treating around 48,000 children every year. So we are really treating the newborn babies and also getting rid out of the backlog in the country. We are working through partnership with hospitals, and we truly believe that local competencies and local doctors are the best people to take care of cleft lip and palate children. While doing this, we really need the help and the collaboration from the governments, from other corporations as well. The register, how can we register patients? How can we register the children, the newborn babies? There should be some sort of collaboration between the governmental hospitals and polyclinics in the rural areas who can really register the newborn babies and report it to Smile Train partner hospitals. The transportation, if we can collaborate more of transportation for the patient in the very rural area to the main cities. Also, collaboration in terms of malnutrition. If we can teach and if you can educate and if we can really provide enough information about how can we collaborate more in order to feed the newborn babies to prepare them for the cleft surgeries. So we really need the registry with the government, the transportation, and also nutritional system in the country in order to help the children to be prepared for the cleft surgeries. Smile Train has been doing charity work for cleft-born children around the world for the last 17 years, and we will be continuing doing this work. So one of our main objectives is to spread awareness about Smile Train programs in the existing countries. We've been doing this work in more than 80 countries around the world. Right now, one of our main objectives is to penetrate more countries around the world and to spread the word of mouth and awareness about cleft. About cleft in terms that cleft is a treatable disease. Cleft is not a curse. Some families in some underdeveloped countries tend to isolate the new cleft-born baby, and some countries consider the cleft newborn baby as a curse, and even they will kill the baby. So they spread only the three surgeries for cleft, but also orthodontic therapy and ancillary therapy. When it comes to speech therapy as well, Smile is in this area. So we treat the child comprehensively, offering speech service and also orthodontic and speech therapy.